Eye doctors typically tell patients that the human eye is like a camera. While this is true to a degree, if you try to push the camera analogy very far, it soon falls apart and creates confusion. While the eye does have a lens like a camera, the human eye has two focusing elements that are anatomically quite distinct. The part of the eye that does the most work focusing things is the cornea. This is where contact lens would sit. In fact, the cornea does almost 2/3 of the total job focusing things in the human eye, while the natural lens does the rest. The job of this natural lens is to provide the extra focusing power on demand that we need to see up close. The default focal point for the normal eye is way off at a distance. This means that if you were sitting back in a chair outdoors, your relaxed gaze would be on the horizon. If someone were to push a book or newspaper in your lap, you would have to make a conscious effort to physically pull your gaze up close to be able to read it. This change to near focus requires a voluntary effort using muscles inside the eye. In a camera, changing focus involves moving the lens optic forward or backward. In the human eye, however, our lens actually changes shape. When we shift our attention up close, the muscle surrounding the lens of the eye contracts, squeezing it around the middle. Unlike the cornea, which is solid and clear like silicone, the natural lens of the eye, at least when we are young, is soft and squishy, almost like a water balloon. Squeezing the lens around its middle causes the front and back to bulge, making the lens thicker. A thicker lens has a closer focal point, which gives us the magnification we need to see up close. When we are young, this change happens so effortlessly and instantaneously, we don't even know we are doing it. It seems to us like everything is always in focus. But as you can now appreciate, this is not actually the case. Eye doctors call this ability to change focus by squeezing the lens accommodation. The problem is, as we get older, the natural lens of the eye starts to harden and becomes more dense. Even before we turn 40, this hardening of the lens creates slowly increasing resistance to the muscle trying to squeeze it into the proper shape for reading. By the time we reach our mid to late 40s, the lens has become so dense and unyielding, it creates a significant problem seeing things at near, despite our efforts to work around it by turning up the lights or holding the page at arm's length. The first solution most people try is a borrowed pair of drugstore reading glasses, and there is nothing wrong with that. As we continue to age, the natural lens becomes even more dense, with even more resistance to the focusing muscle. So we end up buying stronger reading glasses, and soon become dependent on them. As the lens continues to harden into our 50s, it also begins to discolor, becoming progressively more yellow and cloudy. Eventually, this hardening and discoloration gets bad enough, we call the aging lens a cataract. So you can now realize that this is not a disease, not a film or skim over the eye, but rather just the natural lens itself as it ages and malfunctions. What we call a cataract is the end stage of this natural aging process of the lens of our eye. A cataract operation is the eventual removal and replacement of the natural lens once the hardening and clouding becomes fully developed. But with a standard cataract operation, post-op glasses are usually necessary. Before the invention of lens implants, cataract surgery patients had to wear very heavy and thick Coke bottle glasses to see. But the technology of lens implant surgery has advanced tremendously, making available a procedure that can provide correction for both distance and near vision, as well as fixing whatever degree of cataract your natural lens may or may not already have. PreLex is short for presbyopic lens exchange. It is the microsurgical removal and replacement of the aging lens with a brand new, soft and clear synthetic lens implant. This lens implant is designed and selected to automatically focus at distance, intermediate, and at near, with minimal, or more typically, no need for reading glasses. And if you have to wear glasses now for nearsightedness or astigmatism, as well as for presbyopia, the same lens implant can usually be selected to fix those problems at the same time as well. You will never get cataracts afterwards, because PreLex is effectively a preemptive and permanent removal of that aging part of the eye, the lens, that would have eventually become a cataract. So, PreLex means presbyopic lens exchange, the removal and replacement of the aging natural lens with any degree of hardening, discoloration, or frank cataract to provide distance and near vision in both eyes with minimal or no need for glasses in the years to come.